guys, and welcome back to my channel. I am Zindi, your pharmacist, and this is Health Talk TT. Now, today we want to talk about managing comorbidities during the COVID crisis. And I want to start with diabetes. Now, you've been hearing that patients who have diabetes are at risk. You may be wondering how or why, and today I want to share some information with you. I have 5 tips that would help you manage your diabetes better during this crisis time, but I also want to share with you some numbers, and I want to explain to you why you are at risk. I do believe that persons who know better do better. So you may know you're at risk, but you don't know to what extent. And today I want to clear that up. So let me share with you some numbers first. Trinidad and Tobago are a part of the list of countries who have the highest numbers and the fastest growing numbers when it comes to diabetes. Our population, according to the Ministry of Health, is estimated that 14.5% of our population here in this beautiful twin island is affected by this disease, diabetes. Now, 14.5% may not sound like it's a big percentage, but 14.5% of approximately 1.4 million is around 200,000 people. 200,000. That's a big number, and we should be hugely concerned. Now, diabetes is not just one disorder, it's actually a group of metabolic disorders, and it's usually as a result of some insufficiency of insulin in one form or the other. And it's characterized by hyperglycemia. I stress on the hyper so you know that means high blood glucose level. Now, we have so much persons here in Trinidad and Tobago who are affected by diabetes. A large percentage of the 200,000 that I mentioned earlier, they suffer with type 2 diabetes. But by no means do we want to disregard the other types of diabetes that exist. Now, I want to share with you why you are at risk. I know that those of us who are in health, we are aware that persons with comorbidities are at increased risk for COVID-19. But I want to speak to you, those who are pre-diabetic or diagnosed with diabetes, why it is a risk for you. I will be glancing at my notes to keep on track. Now, it's a double challenge for you as a patient who has diabetes. One, because of the severity of the disease, and two, because so much has changed with your routines that it could affect your meal times or your types of meal. And if you're a diabetic patient, you know that managing your meals and having your meals on time and what you eat really does affect how you manage your glycemic levels. And that is really important. So the risk is threefold when it comes to persons with diabetes. But I want to just state one fact. Patients who have diabetes, your immune response is impaired as it relates to any infection. That's across the board. Whether it's a yeast infection, genitalia, or topically on your skin, or some measure of some other form of infection, you are more at risk than a person who does not have diabetes. So let's just start there. Now, when it comes to COVID-19, why are you specifically at risk? Number one is poor glycemic control. If you're not taking your medication, you're not physically active, you have not changed your diet, you've not been going to clinics, you've not been monitoring your blood sugar, most likely your blood sugar levels are high. And that high glycemic index leaves you vulnerable to the COVID virus, which is it's a viral infection, so you are at risk for that, but you're also at risk for secondary bacterial infections of the lungs. So either way, if your blood sugar is not low, you are increasing your risk. Secondly, if you're overweight, you have excess weight, or struggling with obesity, you are also at risk if you are a diabetic patient. Sadly, most persons who are diabetic are struggling with overweight, issues in one way or the other. And because of that, I would link this study below. There's a study done in 2009 when there was the H1N1 epidemic. And the study showed that persons who were obese had longer hospital stays and longer ICU stays. And so therefore, already you now have a risk, which is diabetes, on top of another risk, which is the excess of weight. Thirdly and lastly, how else are you at risk? Are the complications. And if you're diabetic, then, and especially for a long period of time, you may be suffering from secondary complications like kidney disease or heart disease, which means your body is weak, it's tired, it's frail, it's not going to fight as aggressively as somebody who's healthy, as their body would. So now you understand why you are at risk. So you may have known, yeah, I'm at risk, but I could take a chance. No. Now you know that you are at risk. Now you know why and to what extent. So please listen to me as I share 5 tips that will help you manage your blood sugar levels while you are going through this COVID crisis. Number 1, make sure and get your prescriptions filled. So whatever your last up-to-date prescription is, make sure you get it filled. Whether you're using the CDAP program, you're getting a medication through clinics or hospitals or health centers, or you're able to purchase it, get your medication. Tip 2, when you get your medication, what are you going to do with it? You are going to use it. I cannot stress how important patient compliance is during this time. I believe it's one of the reasons why pharmacies are still open, because we need you all as patients to take your medication. Take it as prescribed for the period of time it was prescribed for and at the strength or dose it has been prescribed. For example, metformin twice a day, take your metformin morning and evening. If it's twice a day for a month, make sure and take it for the month. Patient compliance is key. Thirdly, daily self-monitoring of your blood glucose level. What I want you to do when you get up in the morning after you pray is that you check your blood sugar levels. Make sure and check your blood sugar levels and take a note of it, the date, what your reading is, and the time of day you took that reading. And then you could go whenever you're to next clinic date, whenever you have to see your physician again, you can go with that information so your doctors can make a more informed decision moving forward on your treatment. Fourthly, make a daily decision to eat healthy. Now, I understand that we're in difficult times. So for some of y'all, you may not have the option as to what you are going to eat. You may not be able to afford the healthier options. But when you can choose the healthiest option. And if you can't, focus on your portion control. So you may not be able to say, I can't buy the white flour. But in the consumption of your white flour, please be cautious of how much you consume. And lastly, keep physically active, please. Whether you're doing a Zoom online class or you're doing a squat challenge, you're teaming up with your neighbor, but your neighbor is watching you through the window. Make sure and stay physically active. You have to stay physically active because that's actually going to help reduce your risk of being overweight. So guys, these are my tips for you today. Thank you for joining me here at Health Talk TT. Please like this video, subscribe to this channel, and please share. There must be at least one person that you know who is diabetic and would greatly appreciate this information. Also, if you have any suggested topics that you'd like to see me cover on this channel, or you have questions that you want to see me answer, I may be doing a question answer segment. Email me those questions at healthtalktt@gmail.com. Thank you so much, guys.